Pediatric surgery is a multidisciplinary field that encompasses many surgical specialties. Most procedures can be classified into one of three groups: surgery for the treatment of a congenital anomaly, procedures for the treatment of a disease, or trauma surgery. Many procedures done in pediatric surgery can be performed on adults as well. Please look over the outcomes for this chapter. Pediatric patients are typically grouped according to the following biologic age groups. They range in age from newborn to adolescent, so patients in pediatrics come in a huge range of sizes. The care of the pediatric patient is distinctive and a separate specialty. Pediatric patients do not act like adults. Their physical and psychological responses are different and they should not be treated as an adult. A child's comprehension and response to a situation are based on his or her developmental stage, not necessarily his or her chronological age. The family dynamic is also important and sometimes the most challenging. Pediatric patients' respiratory system and airway are different than that of an adult. They have a tongue that is large in proportion to the oral cavity. Infants less than 8 weeks are obligate nose breathers. The trachea is much shorter and smaller in diameter than in an adult, and it's also more delicate and less rigid. Failure to maintain the pediatric airway is among the leading causes of death in medical and traumatic emergencies. The thoracic wall is weak and unstable, and the lung residual capacity is much lower in children than in adults. The most dramatic changes in the cardiovascular system occur at birth with the transition from fetal circulation. Fluid balance is maintaining the correct amount and types of fluids in the body spaces. It's very important with the pediatric patient. This patient population has little blood reserve and cannot tolerate persistent bleeding, and hemostasis is critical. Many procedures that can be done using local or MAC on an adult require general anesthesia for the pediatric patient so that the anesthesia provider can better maintain the airway. Children are more sensitive to small variations in drug doses, and microdrips are usually needed. The patient is usually induced and maintained under anesthesia with an inhalation agent, and then the IV is established. Physiological mechanisms that normally regulate temperature in adults are absent or underdeveloped in the infant. Shivering is a compensatory reaction in adults, but it's lacking in infants. Infants and children tend to lose more heat than they generate. There are many environmental factors that put a pediatric patient at risk for hyperthermia around the OR, such as cold surfaces, cold air, prep solutions, and wet linens. Hypothermia can result in a chain of physiological events that place a pediatric patient at risk for cardiac problems, apnea, and hypoglycemia. Hyperthermia is less of a risk. However, it can occur in the misuse of a warming device, or malignant hypothermia is a greater risk in pediatric patients than in adults. Nomothermia can be regulated by pre-warming the OR, using warm air blankets, such as a bear hugger, or using water-filled blankets, heat lamps, solution warmers, and sponges moistened with warm saline prior to use. Pediatric patients are particularly vulnerable to risks related to their age, size, and stage of development. They are at higher risk of adverse events from overdosing medications. The team needs to use appropriate padding when positioning. Children have extremely flexible joints and delicate skin. The appropriate sized bovie pads should be used and never cut an adult pad down to size. Pediatric instruments may be smaller, or just the tips might be smaller, and pediatric patients can be carried or taken into the OR in a heated isolette or in a crib. Most of the pediatric surgery is done to correct structural defects that develop during fetal life. These congenital defects can be genetic or acquired. Acquired defects fall under three categories. Teratogen is a chemical or drug that injures the embryo or fetus, such as alcohol or an infectious disease. Metagenic is a substance that causes a gene to mutate, such as X-rays. And material diet, such as lack of folic acid, can cause an acquired congenital defect. The most vulnerable period in fetal life is the first 60 days because this is the time of rapid cellular and tissue differentiation.